Hi, my name is Milena and I am Canadian Hemophilia Society Manitoba chapter president. I'm also chairing a Women and Girls with Bleeding Disorders Committee and Education Committee. I became aware of that maybe 10 years ago when I heard many personal stories of women not having an access to care. They were not able to manage their bleeding disorder the way they should. And also, because I'm interested in research, I saw the same problem in research, saying that women are underdiagnosed, undertreated, and that to diagnose a woman with bleeding disorders need an average 8 to 16 years. So I knew that at that time that I would be really interested in helping women get better access to care.
I'm Dr. Emily Rimmer. I'm an adult hematologist at Cancer Care Manitoba and the Health Sciences Center. I'm also one of the 2 adult clinic directors of the Manitoba Bleeding Disorders Program. I've been interested in women's issues related to hematology for a long time. And after I finished my hematology training, I went on to do a 2-year bleeding disorders fellowship. As part of that, I became interested in women and girls with bleeding disorders, related to some research that I did in the field and attending various clinics for women with bleeding disorders. I would say that there has been a major shift in the last 10 or more years in terms of focusing on women and girls with bleeding disorders. And in part that's related to increased awareness of bleeding symptoms in women and how they differ from bleeding symptoms in men. Women and girls with bleeding symptoms or bleeding disorders are becoming more aware of the fact that this bleeding may not be normal and are becoming empowered to ask for medical assistance in management of bleeding symptoms. I think that many societies, like the Canadian Hemophilia Society, as well as social media and internet resources like Let's Talk Period, have really helped to just get that information out there to women and girls with bleeding symptoms.
The major thing is information, and we really last year we worked on a website. It's a wonderful website it's for women's health, and in this website you can see pipeline to care, every information possible needed for women with bleeding disorders. This is a website for women that are diagnosed, but also women that are not diagnosed at the same time.
So where I see our care of women and girls with bleeding disorders in Manitoba going is that ideally I'd like to see a multidisciplinary clinic incorporating obstetricians and gynecologists as well as anesthesia to provide medical care specific to women.
Women's clinic is one stop for all women with bleeding disorders, so they can have a hematologist, a nurse, obstetrician, gynecologist, obstetrician, and then also they would have a prenatal or possibly diagnosis and also genetic counseling at this place. So this is our dream, and we are working on it, and we are very grateful that Manitoba Bleeding Disorder Program is in fact work with us on this great project.